Now, while the number of COVID-19 cases has been steadily increasing, South Africa has not officially hit a third wave just yet. But 4 provinces are currently in the grips of a third resurgence. There were 3,285 new infections in the last 24 hours. A further 89 people have died, bringing the total number of fatalities to over 57,000 people. More than 1 million people have now been vaccinated in the country. Well, for more on a possible third wave across the country, let's speak now to the National Institute for Communicable Diseases Senior Medical Epidemiologist, Dr. Harry Moultrie. Dr. Moultrie, good afternoon. Thank you very much for your time and welcome to the Midday View on eNCA. Just a short while ago, Dr. Mkhize was addressing the media in Kimberley, where he was visiting the Northern Cape. He was asked about the third wave and, of course, the vaccine rollout, and he pointed out 4 provinces, again, Gauteng, the Free State, Northern Cape and Northwest, as where officially there is a third wave of the coronavirus, but not in the rest of the country. And we here in Gauteng are leading the pack. From your information as the NICD, is that still the case? Only 4 of the 9 provinces are in the middle of a third wave?
That's correct. The third wave definitions are defined as a percentage of the previous peak of the previous wave, and 4 provinces have crossed the threshold. However, it is likely that South Africa as a whole at a national level will cross the third wave threshold sometime in the next week to 10 days.
What is the threshold?
The threshold is, at a national level, is defined as 30% of the peak 7-day moving average cases of the previous wave. Wave 2 in South Africa at a national level peaked at about 18,000 cases. 30% of that is just under 6,000, about 5,600 cases. Our 7-day moving average is currently, as of today, approaching 5,000 cases a day. But when we go back to the end of May, 31st of May, it was 4,000 cases. So it's rapidly increasing. And we can expect to breach the third wave threshold in the next week or 10 days. I think what's important to note, though, is that whether or not we've breached the threshold is that we need to act, and we need to act now to limit transmission and decrease the spread.
What is that action? What does it look like?
We know those actions. We've recently increased our restrictions at the national level, increasing curfews and limiting gatherings. But individuals need to take personal action to protect themselves and their families by maintaining social distancing, avoiding large indoor gatherings, hand sanitizing, mask wearing.
So you're thinking further restrictions will be required in the next 10 days to avoid a national third wave?
No, that's not what I said. I think that the growth in cases is largely, for the next 5 or 7 days, is largely already baked into the system. And I don't think restrictions at this point will have an immediate impact on cases over the next week. So I'm not convinced that additional restrictions at national level are required. I think we all just need to take greater responsibility.
So that threshold will be around about 6,000 cases over a period of time, and you believing from what you're seeing as a NICD that we're not going to avoid a national third wave, no matter what we do?
It certainly doesn't seem that we're going to avoid crossing the third wave threshold at national level.
Yeah.
The threshold's a moving average of just over 5,600 cases. We're at 5,000 at the moment, and we're growing strongly.
Yeah, so in short, I mean, in layman's language, the possibility of a third wave, highly likely.
Yes.
So in terms of actions then, avoid gatherings, you've said. You don't think any further lockdown restrictions would assist us currently because the numbers are moving in that direction anyway. It's going to largely be up to you and me, up to us, up to individuals, therefore, to follow the necessary precautions. Will that be the major effort that should be driven by all stakeholders? The messaging again around please take care, wear your mask, physical distance, wash your hands, and stuff like that, avoid gatherings?
That's right. While additional restrictions nationally imposed might become necessary, should hospital systems and hospital beds come under severe pressure,
And alcohol will be one of them that will have to be restricted, because we understand that alcohol is not directly linked to coronavirus in sense, but it puts pressure on the emergency rooms and resources of hospitals and diverts attention from COVID-19 to those kind of emergency trauma situations.
Certainly, if we get to a point that we're running short of ICU and hospital beds, then additional restrictions need to be considered. And those include greater restrictions on curfews, increased restrictions on gatherings, and potentially alcohol restrictions.
Dr. Harry Moultrie from the NICD, thank you very much for your time and insights this hour. You heard him, highly likely. There's no way now the country is going to avoid a third coronavirus wave. The numbers are moving in that direction. So please do take care.